In this video, we're going to break down exactly how Epic Systems works and why it powers some of the world's largest hospitals and healthcare networks. We'll start by exploring Epic's core platforms, including Epic Share, Cosmos, and the MyChart patient portal. Then we'll look at how Epic organizes its software into specialized categories for hospitals, clinics, rehabilitation centers, and even home care services, each designed for different healthcare needs. After that, we'll break down how Epic uses interoperability, automation, and artificial intelligence to improve workflows, reduce manual work, and enhance patient care across different systems. Finally, we'll cover how organizations implement Epic, including its customized setup process and how pricing is handled based on hospital size and requirements. So, without wasting any more time, let's get started. To begin our journey, open a browser and head to the official Epic website. The homepage serves as the main gateway into Epic's connected healthcare ecosystem, where every platform supports a different part of modern medicine and hospital management operations worldwide today. First is Epic Share, a collaboration hub for healthcare organizations that use Epic Systems. Hospitals, clinics, and administrators can exchange workflows, software guides, operational strategies, and best practices to improve efficiency. If one hospital develops a faster patient intake method, other facilities across the network can quickly adopt the same approach and improve performance. Next is Epic Research, which focuses on data-driven clinical insights. By using anonymized patient information gathered from Epic's network, researchers can study treatment effectiveness, track disease trends, analyze public health patterns, and identify healthcare disparities. This gives medical professionals a broader understanding of real-world clinical outcomes across different populations and healthcare environments worldwide. Closely linked to this is Epic Cosmos, one of the world's largest anonymous health data networks. It combines hundreds of millions of patient records from thousands of hospitals and clinics. Researchers and physicians use Cosmos for large-scale studies, benchmarking, and evaluating how patients with rare conditions respond to different treatment plans and medications in real clinical settings every single day. On the patient side, MyChart provides direct access to personal medical information. Patients can review lab results, manage prescriptions, message healthcare providers, schedule appointments, and attend telehealth visits. The platform also integrates with wearable health devices, helping users actively track wellness and stay involved in their own healthcare management process more effectively. For developers and engineers, OpenEpic focuses on interoperability. It uses the FHIR standard, or Fast Healthcare Interoperability Resources, which acts like a universal language for medical data exchange. Through OpenEpic, developers can build secure third-party applications that integrate directly into Epic Systems, allowing hospitals to expand software capabilities and improve operational flexibility without disrupting existing workflows. Finally, Epic includes two restricted customer portals. UserWeb is a secure platform for hospital IT teams, clinicians, and administrators to access updates, training resources, and troubleshooting forums. Alongside it is the Epic Showroom, an approved marketplace where third-party vendors present Epic-compatible tools that improve billing systems, patient engagement, communication, and overall hospital operations across large healthcare organizations globally today. Now let's take a look at Epic Software's specialized categories. First are standalone specialties, designed for individual medical fields like dentistry, oncology, cardiology, orthopedics, nephrology, and urology. These systems include specialty-specific forms, diagnostic templates, and customized charting workflows tailored to each field's daily operations. Next is Health Systems and Clinics, the company's largest platform for hospitals, trauma centers, and outpatient networks. It runs on Epic's modern interface called Hyperdrive, which replaced the older Hyperspace application. Hyperdrive manages scheduling, clinical charting, physician documentation, medication records, and billing across inpatient, outpatient, and emergency departments. Epic also supports recovery-focused care through its post-acute and care in the home categories. These tools are built for rehabilitation centers, nursing homes, and home healthcare agencies. Nurses and therapists can document recovery progress on mobile devices while automatically syncing updates to the patient's main hospital record. Another major category is payer and patient experience, which connects healthcare providers with insurance companies. Authorized payers can securely verify eligibility, process claims, manage benefits, and speed up approvals. At the same time, patient-facing systems improve scheduling, communication, and overall usability for patients. For urgent care centers and retail clinics, Epic offers convenient care workflows. These streamlined templates help medical staff quickly treat minor illnesses and injuries while still accessing a patient's complete medical history. On the other side, the social safety net category is designed for public hospitals and community health organizations. It includes tools for grant management, public assistance integration, and sliding scale billing to support underserved populations. Finally, Epic contributes heavily to medical innovation through its life sciences category. This platform connects pharmaceutical companies, biotech firms, and clinical research centers with real-world clinical data. It helps speed up drug development, improve clinical trial recruitment, and monitor long-term medication safety. What separates Epic from traditional database software is its strong focus on connectivity and intelligent automation. In the past, visiting a hospital that used a different system often meant doctors could not easily access your medical history. Epic addresses this through advanced interoperability tools like Care Everywhere and support for TEFCA. These systems allow secure sharing of medical information between healthcare organizations, even if they use different electronic health record platforms. Epic has also invested heavily in artificial intelligence and machine learning through its Healthcare Intelligence Initiative. These tools are designed to improve patient care and reduce administrative workload. For example, predictive analytics can monitor patient vitals and identify individuals at high risk for conditions like sepsis or hospital readmission before problems become critical. Epic's AI can assist with ambient documentation by securely listening to doctor-patient conversations and automatically generating clinical notes. The system can also help nurses complete end-of-shift summaries and automate electronic prior authorizations. If you visit the footer of the official Epic website, one thing becomes immediately clear. Epic does not offer public pricing because its software is fully customized. Costs depend on organization size, patient volume, clinicians, and required features. So, hospitals must contact Epic directly for consultations and estimates. And there you have a complete, step-by-step overview of how the Epic ecosystem works. Understanding this platform is a massive advantage in today's rapidly evolving healthcare landscape. Thanks so much for watching, and we'll see you in the next one.